Yeah, definitely. So that's usually not the preferred topic in our community, and I hope there will be some people in the room, because that's definitely of utmost importance. So EBMT and the Go-CAR-T coalition that I mentioned before is working with the European Commission, with representatives at the European Parliament, in order to know better about the upcoming changes in the European regulations, in the European regulatory landscape. And there are at least two regulatory documents that are of extreme importance to us. One is the fact that the directives on cells and tissues that were published close to 20 years ago are now being revised and will be likely transformed in a regulation on blood cells and tissues. So EBMT is working to maintain some basic principles in the field, including gratuity, voluntary unpaid donation, donor safety in the short, middle, and long term, sustainability of supply in European countries, and such principles that are really important to the academic community. And the other regulatory documents are the pharma regulations, and very likely the upcoming regulations of the advanced therapy medicinal products. And EBMT is very keen to maintain access to what is called the hospital exemption. This is a provision that is embedded in the ATMP regulation and allows academic centers to manufacture under certain conditions CAR-T cells or other types of gene therapies that are being used in the field of hematology and oncology. Very important to promote equal access to these treatments in many European countries and associated member states.